When you first wake up from surgery, you'll probably feel woozy and possibly a bit confused. You'll still have an oxygen mask on at this point, and it is important to keep it on to provide extra oxygen to your system. To help your circulation, you may also have a sequential compression device, or SCD, on your legs, which resembles a boot. If you do, you will hear it operating as you feel it squeezing and releasing. After you've stabilized in the recovery room, you'll be transported up to your room in a hospital bed or stretcher. One of the biggest surprises for many of our joint replacement patients is that you may begin your exercises right away, doing things like walking from the stretcher to your bed. Your care team will get you moving as soon as possible to get blood flowing to the surgery region and improve your range of motion. You may have ice treatments to reduce the swelling. You'll do breathing exercises to help prevent pneumonia. Sometimes on that first day, and always on the day after surgery, a physical therapist will get you up and moving. The physical therapy team will work with you during your stay. They will teach joint replacement patients the proper exercises, and they'll make sure that you can get in and out of a bed or chair, walk with an assistive device, and go up and down stairs. They'll work with spine patients on techniques to protect your spine while working on tasks such as getting in and out of bed or a chair, walking, and going up and down stairs. Nursing staff will walk with you and encourage bed exercises. You will also be cared for by a member of the medical hospitalist team who will help coordinate care with your surgeon, nurse, physical therapist, and case manager. This team approach improves the safety and efficiency of your hospital stay. Whether you're in a shared room or private, you'll have an adjustable bed, a television, and the ability to order freshly prepared meals on demand from our culinary team. The nursing team will be focused on making sure your surgical incision is cared for properly, that your pain is controlled, and that you get any help you need to stay safe as you begin your recovery routine. Everyone who comes to your bedside will confirm your identity and repeat similar questions as they work with you. As part of our safe care routine, you will be frequently checked and assessed. Education is an important part of your recovery. Please review all education materials provided in your room. We will do our best to create a restful and healing environment, but you can expect some noise and disruptions throughout the night. It will be a busy experience, and it may be best to limit your visitors to those essential friends or family who will be helping with your care at home. No matter how fit you are, orthopedic surgery puts you at a high risk of falling. For that reason, you will have a yellow band placed on your wrist prior to surgery that will only be removed after careful assessment by the nursing and physical therapy staff. You must avoid any attempts to move around on your own. Call, don't fall is our rule. Always call a nurse for help getting out of bed or going to the bathroom. No matter how good you are feeling, you'll be unstable after surgery, and you don't want to try anything without trained help. You can expect that you will experience some pain and discomfort. Pain levels vary depending on the person and the procedure, so our care team will work with you to keep your pain levels tolerable. Because pain medications are given on an as-needed basis, you'll be asked frequently to rate your pain on a scale of 0 to 10 to determine if your pain is mild, moderate, or severe. No matter how pain tolerant you are, it is important to your healing process to stay ahead of your pain and not let pain levels get too high. It's important to be honest with your care team about any pain medications you might currently be using. Certain drugs, such as opioid pain medications, can be less effective if used frequently. Also, be aware that these medications have side effects which can be managed and can include constipation, drowsiness, confusion, and nausea. Before you are discharged, an occupational therapist may see you. They'll work with you on the activities of daily living, helping you learn how to get dressed and how to move around your bathroom and kitchen safely. You may require various tools or equipment to help make these tasks a little easier. Every patient's care plan is individualized and goal-directed, with tailored goals focused around wound care, pain management, and rehabilitation. When you've met all of the goals, you'll be able to leave the hospital. Each patient and each surgery is different, so your care team will be constantly monitoring you and making adjustments to fit your needs. Your care team will work with you to ensure that you are meeting your goals, getting you ready to leave the hospital.